Darren Hughes is director of the Welsh NHS Confederation. Mr. Hughes, we heard today that this was the biggest undertaking of its kind ever, perhaps, in the UK. How difficult is it for the NHS to make sure these vaccines are distributed, given the limitations we've already heard about? How difficult is it to get them to all four corners of Wales?
It's going to be an enormous challenge, whereas, as we heard in the introduction, they need to be stored at very low temperatures. It's something we've been preparing for months, training staff in handling these things at very low temperatures, preparing venues, ensuring that when we are transporting things around, we've been doing dry runs, so to speak, to ensure that we can meet the very stringent conditions that the vaccines need to be kept under. It's really positive news that the vaccine's been approved by the regulatory authorities as safe for use, but it is a huge undertaking to ensure that we can get the vaccine out and get people vaccinated as soon as we possibly can.
As we heard earlier, normally with a vaccine, it is distributed and you go to your GP surgery and you're vaccinated. This is quite different, is it? What kind of places and where are these places where people will have to go to be vaccinated?
It'll be organised locally across Wales by a local health board in sort of cooperation with other partners. And as soon as the vaccine and the locations are available, people will be notified directly, but they will be centres across Wales accessible as we can possibly make it, and ensuring that we can vaccinate those people who are at most risk quickly and safely.
Will staff have to be trained how to inject the vaccine? I'd imagine that some vaccines are different to others. I mean, are there going to be specific features about this vaccine which will mean training staff to actually undertake the vaccinations as well?
I think throughout the COVID pandemic, what we've seen is the most important thing in all of this, as you pointed out, is staff. We can, manufacture things and make things and buy things, but we can't do it without the staff. The training started for general vaccinations some time ago. At that point, we didn't know exactly which vaccine would be available first. So Health Education and Improvement Wales, who oversees training for the healthcare workforce across Wales, have been training people for some months, and now we're in a position, the vaccine's approved, to get them trained with the skills they need for this particular vaccination, to ensure that support is there for those colleagues, for people highly experienced in vaccination programmes, and other clinicians are there to support them. But it's been a huge challenge training the workforce so quickly. And as you said at the beginning, it's an enormous project, vaccinating as many people. And, this vaccination requires 2 doses. So it's a huge challenge. Things like computer systems needing to be prepared as well, so we can record who's being vaccinated, so that we can contact those people in priority order. It's an enormous undertaking.
Great, that's Darren Hughes, Director of the Welsh NHS Confederation, on, as he says, the enormous undertaking of making sure the vaccine is rolled out across the whole of Wales.